Yesterday at 3:30, I was notified by the Department of Public Health of a probable case of H1N1 in the Fall River Public School System. The department called back at approximately 6 p.m. to say that the case was confirmed. At 8:30, we notified all parents using our telephone notification system. We advised parents that a school staff member has a confirmed case of H1N1. For reasons of confidentiality and privacy, the Department of Public Health continues to advise us not to release the name of the school. Please know that we are unable to go into specifics of the case except to say it's a mild case under treatment. The person was not ill while in school and has not returned to school, which means there was a minimal risk of exposure according to the Department of Public Health. We acknowledge this is the first case in our school system, and in all likelihood, the virus is present in the community. We have been advised by local and state health officials that we should expect to see cases in the community as time goes on. This is supported by the recent change in the Department of Public Health guidelines, where they no longer recommend the closing of schools in which there are confirmed cases. I know this is a scary time for parents. I know it is extremely difficult for parents to learn we cannot name the school, and this lack of information causes alarm and concern. At this time, state and local public health officials have advised that students can and should continue to go to school as long as they are not sick and do not have flu symptoms. At all of our schools in Fall River, we are taking the following precautions. Careful hand washing is very important in preventing the spread of disease, including H1N1. School nurses have been and will continue to conduct hand washing, cover your cough education programs district-wide. They will continue to remind students and staff how important prevention can be. All of our school staff are working to prevent H1N1 through proactive steps, communication, and universal precautions. School nurses have been asked to monitor students and staff for any signs of illness at all schools and to contact the state health department if they notice an increase in absenteeism.
What we're doing, which is of more importance, and which is the overwhelming public health issue, is that one, we want to let people know that this is not sporadic, that the virus is here. And what's important is that people take measures that will both protect themselves and others from spread of this virus. And Meg has gone into those in her letter. You know, the most important thing is for people, if they're not feeling well, if they're ill, to stay at home. The most important thing in the school system, in addition to surveillance and monitoring and looking at absenteeism, is if children are sick, they need to stay at home. If you cough or you sneeze, you need to do so into a tissue or the crook of your elbow. You need to wash your hands frequently with soap and water or the alcohol-based gels. If you're not feeling well, you should be staying home. So we're talking about time-tested, very common sense measures to prevent spreading illness to other people. And conversely, we're talking about measures to prevent yourself. But clearly, hand washing is important. What's being done in the schools, in addition to the monitoring that's going on now by the school nurses, is that yes, we've instructed the custodial staff, to frequently be wiping down the hand railings, the faucets, the doorknobs that people are touching. Just like when you go shopping, to wash the shopping cart with some of those cloths that are provided at most stores, or you have alcohol hand gel. So we're being proactive in both monitoring, watching, trying to see if there are changes in illness and absentee patterns, and making sure that people use good hygiene.